I will zero in on experimental studies, like I've said, because I think this is really the where we should be going, or how we should be thinking in terms of research in mental health, and actually research in any health outcome that we could be interested in. And an experiment, just like the word says, a study in which a treatment or a procedure or a program is intentionally introduced so that you can look at the outcome and say that the outcome is as a result of what we introduced in this. And by introducing, it just means that you could have a new program, a new treatment, or a new way of doing things, and introduce it in the lives of people in a cohort of people, in younger people, and then over time observe what happens and measure the outcomes and attribute the outcomes on the experiment that introduced. And there are 4 elements that are key in any experimental study. Manipulation is one of those, and that's really the introduction of a new treatment, new program. There's a use of controls in RCTs. These are called counterfactuals. There's the issue of random assignments, so not targeting people because they have the attribute of interest, but randomly assigning people in any treatment program. And in terms of evaluating the performance of that program, you can randomly select then beneficiaries of such program to be able to measure the outcome in them. So these really are the main elements of any experimental studies. Unfortunately, delving deeper into this is outside the scope of this module for today, but I'm sure the modules that will be coming, including study designs that will be handled by my colleagues, will delve deeper into this. So we're just introducing this and placing them at the center of mental health research. So when something is manipulated and controlled, because manipulation and control are the 2 most important elements of experimental studies, then the outcome happens, and it makes us more confident that the manipulation caused the outcome. So that's how you look at it, that when you manipulate something and then you have controlled that environment by having a counterfactual, then you can go back and say, really, what I am seeing as the outcome is as a result of the manipulation and not some chance or some outside factor that may not have been measured. Of course, for epidemiologists, we know about, or at least individuals involved in research know about collecting data on confounders or any factor that could mediate, modulate, or affect the outcome in any experiment that you're doing. So really, I just wanted to highlight the experimental studies because of the strength they bring, especially in assessing cause and effect, and attributing or inferring causality, as well as finding the temporal association between one factor to the other. And this perhaps would make any proposal to study not just mental health outcomes stronger compared to another that would be submitted to the same scheme. Again, if you know this, I must apologize for preaching to the converted. But as my ED would always say, sometimes you have to say things many times over and over again. And sometimes they actually sound interesting every time we say them over and over again.